Thank you for coming and letting us share our research with you in our programs. As Maggie said, my name is Monica Oxford. I'm faculty in family and child nursing. I'm also the director of NCAST programs and the interim director of the Barnard Center for Infant Mental Health and Development. NCAST and the Barnard Center for Infant Mental Health and Development were founded by one of our beloved professors, Dr. Kathy Barnard, a scholar, a nurse scientist who really, her research just informed the field of infant mental health when the field didn't even have that phrase. It wasn't even called infant mental health. I'm going to share one of her innovations in her research that she discovered so that you get an idea for the types of programs that we disseminate. She, through her video feedback and looking at parents and children interact, discovered and helped us learn about how babies communicate. They communicate nonverbally. That's the only way they can. So if a baby sends a smile, that's a serve. A return communication would be to receive a smile back. So if I smile, you smile back at me. We're connected. We've made a connection. If I'm a baby and I send a smile and I get an angry face back, that breaks the connection because I don't understand that. I'm confused and maybe even activated. Her research really helped us understand that basic form of communication between parents and children. But besides being an amazing researcher, she was also a extremely passionate nurse practitioner. She didn't want to just publish in journals and get grants, which she did a lot of. She wanted to disseminate all of these ideas and tools like the serve and return into practice, into fields, to work for nurses, home visitors, families in hospitals, help them understand how these babies are communicating so we can meet their needs. And to do that, she founded NCAST programs. So NCAST programs, which I direct, is a research dissemination unit in the University of Washington. We take research, we look at it, we figure out how can we translate this information for the public and for nurses, for nursing education, and then we disseminate it. NCAST has been going strong as a self-sustaining program for a very long time, and we continue to build on her foundational work. I'm going to show you one of the tools that we developed. This is baby cues, and you all have a free baby cues box in your swag bag. So there's about 50 cards in here with cues on them, so you can share those with your family. Compliments of the School of Nursing. Okay, so babies send communication nonverbally. This little baby, this is baby cues. She is sending some information. Her mom is trying to get her to play with blocks. She's actually not in a state to do it. She's sending us this information with her pursed lips. She's looking away from the task and she's pounding the table. Together, this says she's not regulated and we need to stop or change the activity. It's a red light cue. So we use this tool with our vulnerable families, and we have a lot of research to show that when we help parents understand it, they become more sensitive. They become more responsive, which is what we want and what Kathy wanted. Now this little baby is playing the same activity with her dad, and we clearly recognize this communication. She's looking at her dad, her eyes are open, she's smiling, she's engaged, and she's saying, I love that you are spending time with me. Let's keep doing this. I'm in a good state, and I can do this. So this is just one of the tools that we've developed in NCAST program to keep that process that Kathy started many years ago of dissemination. So my ask, Sharks, is for you to help fund a revision of a program that is absolutely phenomenal. This is Keys to Caregiving. This image shows you how dated it is. It's the last program to be revised. When I became director in 2009, my goal was to revise all of our programs, and this is the last one. Now we've got some ideas. Of course, we're going to revise this. To do that and how you would help me fund this is with the $6,000, I'm going to recruit 3 families and I'm going to videotape their newborn. This is a newborn education system. Understanding cues, behavior, communications, feeding, interactions, everything for birth to 3. I'm going to follow those 3 families over the course of the 3 months of the first 3 months of life to redevelop the program, make it quicker, make it more appealing to our younger generation, and make it interactive. So you can give me, through this Shark Tank, funding to do that. Thank you.